Hi everyone, my name is Shruthi. I'm a fourth year medical student, and I recently came across this article, which made me want to make this video to bring awareness to the impact climate change has on our most vulnerable populations. Climate change isn't just about rising temperatures, it's about the air we breathe. Poor air quality, driven by pollution and increasing wildfires, is a major public health crisis disproportionately affecting our children, pregnant individuals, and the elderly. This report from the World Meteorological Organization reports that climate change, wildfires, and air pollution are creating a vicious cycle with escalating negative impacts on human health, ecosystems, and agriculture. Released on September 5th, 2024, the WMO Air Quality and Climate Bulletin highlights the interconnectedness of these issues, emphasizing that pollutants from wildfires can travel across borders and continents, affecting our air quality globally. Air pollution and climate change are closely linked. Global warming worsens air pollution and contributes to drying forests, leading to more wildfires releasing fine particulate matter. This article, Climate Change in Pregnancy, Risk Mitigation, Adaptation, and Resilience, shows that exposure to air pollution during pregnancy has been linked to serious complications, including preterm birth, low birth weight, and even pregnancy loss. Pregnant people have special vulnerabilities to certain environmental exposures because of their unique physiology. Specifically, the normal changes of pregnancy include a 20% increase in oxygen consumption, 40 to 50% increase in minute ventilation, and a 40% increase in cardiac output. This makes pregnant people particularly vulnerable to air pollution and heat stress. Tiny particulate matter, known as PM 2.5, can cross the placenta, leading to inflammation, oxidative stress, and long-term developmental issues for the child. PM 2.5 and toxic chemicals released in wildfire smoke can penetrate deep into the respiratory system and bloodstream, translocate through the placenta, and interfere with fetal development directly or through changes in epigenetic programming. This can lead to increased susceptibility to metabolic disorders like diabetes, obesity, and hypertension. This figure shows how early life exposures to pollutants can have an impact on lifelong health, from before birth well into adulthood. Children exposed to fine particulate matter in utero can develop long-term health conditions and are at higher risk for asthma, allergies, other respiratory issues, neurodevelopmental disorders, and cardiovascular diseases later in life. So what should you do if you are currently pregnant or want to be pregnant and live in an area with poor air quality or have been recently affected by wildfires? Well, you can work with your physician to help create a heat action plan and assess your risk factors for pregnancy complications. The Chilled Out questionnaire is a useful tool for clinicians to assess whether patients have risk factors for excessive heat. Some of the questions include whether or not a patient has air conditioning in their home, whether or not they have a home, whether they have like an air purifier, an HVAC system, things like that. If you're a clinician, it's really important that you review the air quality index with your patients on the heat risk dashboard and just help them know how to use their weather app on their phone. It's important that patients know when the air quality is poor outside so they can take the necessary measures to stay safe. If the AQI is greater than 100, it's better that patients stay indoors. Pregnant patients are also advised to wear N95 masks, especially if they have been affected by wildfires or if the air quality is quite poor. If a patient is pregnant and has asthma, it's important to go over their asthma action plan and also emphasize that even an air quality index between 50 and 100 can cause quite detrimental impacts to their respiratory health, especially during pregnancy. So just making sure that you are informing your patients on how to stay safe is absolutely crucial. I hope this video has been helpful and informative for both patients and providers. I think that empowering ourselves with knowledge on how to protect ourselves now from poor air quality and the wildfires, which have been getting worse and worse, is crucial, especially because this knowledge will help protect our future generations from these harmful impacts.